I'm Professor Tony Redmond. I'm Professor of International Emergency Medicine at the University of Manchester and Director of UK Med. UK Med is an organisation that was founded during the war in Bosnia to recruit, train and deploy healthcare workers, largely from the NHS, at that time to respond to the continuing emergency during the conflict. But since then, it's continued to grow and recruit people and deploy them to a whole range of disasters, including earthquakes, continuing conflicts. But most recently, it was used by the UK government as the focal point for the recruitment, training and deployment of NHS workers into the Ebola crisis in Sierra Leone. We had a huge response from the NHS. We had over 1,600 people volunteered to go into what was probably the most dangerous part of the world at the time. They established emergency Ebola treatment centres. They treated patients. They brought the mortality rate down significantly from what was 80% at the start of the response down to below 40%, which is extremely impressive given the normal fatality rate for that condition. They deployed over many months. We did have one person who contracted Ebola, but thanks to her bravery and the enormous input from the Royal Free Hospital, she has made a full recovery and is now back at work and tells me that she's back to her usual self. On returning from Ebola, people did find it difficult to adjust. Our review of people, our interviews with them, show that the majority by far found this to be a very positive experience, and it reinforced their support for and belief in the NHS and made them realise just how fortunate we are to have a system like that. They did suffer some stigmatisation by colleagues, not a lot, but a significant minority did feel that their colleagues were very wary of them returning to work after they'd been exposed to Ebola. But that has passed now and people are back working normally. Ebola is not over. We have a team on standby, but so far we've not been required to deploy another team now for a couple of months. The lesson I want people to learn from this is that you might consider this to be a natural disaster, but really, if you think about it, there are no natural disasters. There are only natural phenomena. The disaster implies a vulnerability and an inability to respond, and that's man-made. And the poor are the most vulnerable, and Sierra Leone is one of the poorest countries in the world, and following on their civil war had a very fragmented and poorly functioning health service. They were extremely vulnerable. And this vulnerability brought about by poverty is a function of politics and economics. Why is that important? Because we can change that. And as emergency physicians, we can be amongst the strongest advocates for some of the most vulnerable people in the world. And I would encourage all those in the specialty to be their patient's advocate. And my final lesson has been that human beings know and show altruism. And the response of the NHS showed the altruism that's within the NHS, and it showed it in spades.